Itsy spider went up the water spout. Down came the rain and washed the spider out. Out came the sun and dried up all the rain. And the itsy bitsy spider went up the spout again.
Hello and welcome to our overview for child care providers in family child care homes and large family homes. On this program, we're going to talk about your career as a child care professional. Plus, we'll meet some experts who will show us proper ways to provide high quality care to the families and children who depend on you each day. I want to remind you that to be a licensed family child care home or large child care home, you need to follow the requirements that are explained in this book. This program is designed to take you through some of the topics that you're responsible for knowing. Again, use the requirement book to give you details on each of the topics we cover. Now, here's how this training is going to work. I'm going to show you a series of videotapes that we previously developed. Each tape will introduce you to someone who's an expert in a particular field. By the time you finish viewing this tape, you'll be better prepared to provide high-quality care to children. We'll be discussing safeguarding your home to prevent injury, health-related issues, including the importance of immunizations, transporting children safely, how to spot signs of child abuse, sudden infant death syndrome, shaken baby syndrome, fire safety, and behavior and guidance. Our first topic is making a home safe for children. Shelley Stevens Stidham met us some time back and showed us the best way to look for everyday hazards that can be a danger to children. When we made this tape, we were preparing a program geared specifically to caregivers who work with infants and toddlers. Throughout this video, Shelley refers to infants and toddlers, but please know that everything that applies to the infants and toddlers also goes for all young children. Remember to refer to your requirement book for details. With us is Shelley Stevens Stidham. You're with the Oklahoma State Department of Health.
That's
and we
right.
appreciate you joining us.
Well, thank you. I'm glad to be here today.
Tell our viewers a little bit about what you do at the Department of Health.
I'm the director of the Injury Control Division, and what we do is collect information on certain types of injuries, and then we develop programs to help prevent those injuries from ever occurring.
Good. Well, can you tell us a little bit about what we can do to make a child care home or center less dangerous?
Well, David, the fact is that any place that's not child-proof can be potentially deadly to an infant or a toddler. There are a lot of things in the household that we look at every day and we don't give a second thought to, but they can easily injure or even kill a child. For example, children can be poisoned by household chemicals like cleaners or soaps. They can be poisoned by medicines. They can strangle on the cords that hang down from the curtains or the mini blinds, or the electrical cords that go to the TVs and the stereos. They can suffocate from a plastic bag, a plastic trash bag or something like that. And then they can choke on the small objects that might be left laying around, or even food.
A lot of things to think about.
A lot of things. Making the environment safe is probably one of the most critical steps in infant and toddler issues. And the best way to do that is to explore it from their perspective. So today, I'm going to get down on my hands and knees, and I'm going to crawl around the floor of this child care home, and we're going to look at everything from a baby's point of view or a toddler's point of view.
Well, is this something a provider needs to do every day?
No, you don't have to do it every day because I'm not sure your knees would take it, but it's important to do it at least once. It's important to remember that as children become more mobile, infants become more mobile, they start exploring their environment. And one of the ways that they do that is they start putting things in their mouth. So it's important not to have anything within their reach that they can put in their mouth, because what will happen is they can put it in their mouth, they'll swallow it, and it becomes lodged in their throat and it obstructs the airway. Some of the small objects that we need to be concerned about are balloons, buttons, small balls, rubber bands. And when you have children of mixed ages in your care, you need to make sure that some of their toys that might have small parts aren't within reach of infants and toddlers. You need to be sure and check around the trash can to make sure that nothing chokeable missed the can, like this pull tab from an aluminum can, for example, or a pull tab from a disposable bottle or diaper. Choking dangers are greatest for kids under the age of 2.
I'm holding a no-choke testing tube from Lakeshore Learning. Shelley, can you tell me a little bit about how we use this?
Sure. If there's an object that is small enough that will fit into this cleanly, like this balloon does, then that means it's small enough for a child that they could swallow it and choke on it. So you don't want to have something like this within their reach, such as this rubber band. This cat from a Magic Marker fits in there. This Lego toy. All of these objects you need to keep out of reach of children. Now this scrub brush doesn't fit in there, so that would be safe for them.
So, and we've often heard it said that a child shouldn't put something smaller than their fist in their own mouth.
You shouldn't have anything smaller than a child's fist around. That's true. Now come on, Dave, we've got other places to go. Electrical cords are an extreme danger. Not only do they pose the risk of electrical shock, but cords that are hanging and dangling down, like from items like this clock or this lamp, the child could pull on it and pull the object down on top of them. And I see some other household items here that could be potentially hazardous for children, infants and toddlers. So things like this need to be put up and out of reach. And of course your licensing representative will remind you about any uncovered outlets. Household items that could pose a strangulation risk also need your attention, like these cords from the mini blinds. They need to be fastened up and out of reach for children. And another thing you should never do is tie pacifiers to children's clothing or put it around their neck to be worn like a necklace, because they can strangle like that.
Right.
And we also need to be on the lookout for plastic bags like trash bags or dry cleaning bags, or the bags that you use in food preparation, because if a child gets it up against their nose or their mouth, they can suffocate. You know, David, one of the most encouraging trends that we've seen in childhood mortality is a reduction in deaths due to poisonings. But even though poisoning isn't a major cause of death, it's still an important cause of hospitalizations and medical visits. Young children are especially dependent on older people for what goes into their mouth, so most of the poisonings we see in this age group are actually caused by overuse or misuse of medications. So if you've got a child in your care that's taking medication, you need to read the directions very carefully and make sure that you only give them the appropriate dose. It's also important to communicate with any parents as to any reactions that might occur from the children taking the medication. Now, toddlers are most at risk of unintentional poisonings, and at this age, their curiosity far exceeds their ability to assess any risk. And again, they don't benefit from any poison prevention, labeling, or education, so they're entirely dependent on older people to safeguard their environment, put the poisons up and out of their reach.
You know, one thing a lot of us have probably been guilty of, and that's leaving something out and thinking, oh, I'll put this up in just a minute, but that's not really a good idea, is it?
You need to put it up immediately, otherwise it could end up in the child's mouth by mistake later on. And another thing that they need to remember is you need to keep the Poison Control Center's telephone number by the telephone.
Shelley, you went out to the Poison Control Center recently, and we shot some tape while you were out there. Let's go ahead and roll that tape right now for our viewers.
This is the Oklahoma Poison Control Center, and with me is Lori Gormley, who works here as a pharmacist who specializes in poison information. Lori, can you tell us a little bit about the center and what are some of the services you guys provide?
Sure. Well, if anyone ever thinks that anybody has been exposed to a poison or has gotten into some pills or absolutely has any questions about snake bites, plants, anything, they can give us a call. It's a statewide service. We're open 24 hours, 7 days a week. And if you ever even think something's happened, you know, where a person has been exposed to something, definitely call us.
What age group do you get most of your calls about?
Usually about 50% of our human exposures are for children under the age of 6. And it's because they're exploring, they're crawling around, they're looking for things. And we sometimes tell parents or daycare providers, don't get mad at kids who get into things, because that's their way of learning about the world. And so just to keep things up and out of their reach if you don't want them into it.
What type of calls do you get most?
Probably our most common call are cleaning products. And that's because they're so easily accessible. bleach, for instance, people call us and they're just frantic, crying. They're so upset if a kid's drank a little bit of bleach. And luckily, as with most of the calls that we get, we're able to monitor that at home, tell people what to do, and go from there. And the kids are usually just fine. But there are some things where you don't see any warning symptoms, where the kids aren't crying or anything, but you still need to call us because something could be going on inside.
So again, if somebody is watching a child and they suspect that they may have ingested something that they shouldn't, what should they do?
Give us a call at the Oklahoma Poison Center.
Lori, about how many calls do you all get here?
I think a lot of people are surprised to find out that we get over 150 calls a lot of days, but around 150 per day. And for children less than 6 years of age, last year we got over 18,000 calls. And another thing that a lot of people are surprised to find out is that the way the Poison Center works to help you, one, that we're here for you, but I think people are surprised that over 75% of our calls we keep at home. It's our goal to help you out, and we're conservative in that, so we're not going to keep you at home if it's a risk for the child. But most of the time we can handle a call at home properly by the people letting us know what they got into, how much, when it happened. We can tell you what to do, what to watch for, and keep kids at home. And that's how we save you money, that's how we save the state money, because it's also been found in surveys that in areas that wouldn't have a poison center, about 75% of people are going to get help, usually in an emergency room, which makes sense because if you think about it, if you're sitting there and you're scared to death that your kid, people will think that their kid is going to die, and they're going to be all right, but they're scared, so they're going to get help from the emergency room. So it's good that poison centers are here to keep them at home and help them.
Well, that's a valuable service in itself. Who answers the phone here?
Well, everybody that works here at our center is a pharmacist, or we have one lady that's in school, in nursing school. But poison centers are staffed by nurses, pharmacists, or doctors in Oklahoma. And that's a national thing. Sometimes they have people that'll be with a certified specialist. But I think that it's kind of misunderstood that sometimes people think it's just volunteers, but we all have a medical background.
Well, I see a lot of materials here, so evidently you guys do more than just answer the telephone. So what are some of these things?
Yeah, that's one of my favorite parts about my job is that I go out and I talk to kids and adults about poison prevention. These are a few things that we have available. This is a brochure or some lesson plans that are for pre-K through 3rd grade and are available by just calling the Poison Center. We also have a home checklist, which is good for anybody because I mentioned that you need to keep kids away from the poisons, and this will help you do that. It goes through each room and kind of helps you poison-proof it real quickly. And then we also have brochures, First Aid for Poisoning. We have one on plants, and then one called Perilous Partners, which is about snakes and spiders and chiggers and ticks, which are all poisons and can, cause problems or lead to diseases. So these are really helpful for a lot of people, and you can get those by calling the Poison Center. And then we take out with us a board, and this kind of goes through the different ways that people are exposed to poisons. The most common ways are on the skin, which would include a spider bite or a snake bite, people swallowing a poison. Then they also can sometimes get it in their eyes, and by breathing something in or inhaling it. All of these things are some general first aid, which is mentioned in the First Aid for Poisoning on how to handle those exposures. The pictures on this board are some common things that people can be exposed to as well.
Lori, I see a lot of household products over here, and a lot of them look alike.
Yeah, these are our lookalikes, a few of them at least. It's easy to see for adults especially that this is something that looks alike. They'll clean their kitchen sink with Comet, and then they'll have some pizza or some spaghetti, and they'll sprinkle it with this. Luckily, they usually don't get sick, it just tastes real bad. But there's some other lookalikes here, and it's easy to see how kids could mistake Gatorade for Mr. Clean, and as well as a real common one that the mistake is bleach for water. So that just shows how easily things can happen, especially with kids who can't read and who don't know.
Well, I see something else here that I've had in my cabinets before, and that's the syrup of Ipotec.
This should be in everyone's household, And it's recommended to actually have one bottle for every child under the age of 5, because if you use this, sometimes you'll need to use it on a couple of kids because you don't know who got what. But what it does is it causes people to throw up. But what I like to tell people about this and make sure they understand is don't automatically give this. If somebody gets into something, you always need to call us before giving this, or call the doctor, because there are times you don't want to give it, such as if you swallow something that burns like bleach, it'll burn coming up. Or for oily substances, they have a tendency to slip to the lungs, and it's called aspiration, but you increase that by making them throw up. And if it's in their stomach, they're going to be okay. So that's another instance where you don't want to give it. But like I said, just always call us before giving it, but make sure you have some.
Okay. What type of information are callers expected to give when they call you?
Well, when they call, we'll ask them for the child's age, the child's weight, what they got into, how much they got into, when it happened. We'll also ask for the person's name who's calling and their telephone number. It's not because we're being nosy, but like I said earlier, we want to make sure they're okay. We usually ask them to call us back, but if they happen to forget, which can happen easily in a daycare because you're just so busy, then we'll give them a call and make sure everything's all right. And I always tell people that if we do go to the emergency room, take the substance with you as well as the child. We've had cases where people show up at the emergency room and they're so scared that they even forget to bring their kids. So
That
the
could be a
substance and the
problem.
kid when you go to the hospital.
Lori, this has been fascinating and very helpful. Every call you guys get, you're potentially saving someone's life.
That's right. That's why we remind everybody, please give us a call no matter what you think a kid has gotten into, even if you don't know for sure. And we also want to remind everybody that it is required that you have the Oklahoma Poison Center sticker posted in the child care centers and home. And the last reminder is keep everything up and out of reach.
Thank you.
Thanks.
Shelley, there's one last area we do need to cover in discussing choking and the young children.
That's right. You know, David, it's ironic that even things that children are meant to consume can be dangerous. Every year in this country, we have about 75 people die from choking on food. And round foods and those that are pliable and can conform to the airway are probably the most dangerous. Let's look at some potentially hazardous foods. Hot dogs, round hard candies, popcorn, grapes, nuts, and watermelon seeds are some of the leading culprits in choking-related incidences. If you're going to serve hot dogs and grapes to young children, what you need to make sure you do is cut them lengthwise and then cut them in smaller pieces. You know, David, safeguarding your environment means a change in your perspective. It means that you need to start looking at things from an infant or toddler's point of view. But you also need to remember that there's nothing more important than your constant, undivided attention. And if you prepare your environment before the kids arrive, then you don't have to worry about it and you can spend your time having fun.
Shelley, thanks so much for visiting with us about this topic today. We really appreciate it. Our next expert is Diane Rudebach, an assistant professor at the University of Central Oklahoma. Diane is going to address health-related issues, including the importance of immunization. All of the topics Diane will discuss are found in your requirement book.
Diane, tell us a little bit about your current position at UCO and your background with health inspection.
All right. I am an assistant professor at the University of Central Oklahoma in Edmond, and I coordinate the community health program there. And what that entails is I teach quite a few classes on the control and prevention of disease and focus on prevention and health. And we are in the Department of Kinesiology and Health Studies.
What is kinesiology?
Kinesiology is actually the movement of the body, or studying movement of the body. And so we are in the PE department, and we have the health-related sections of the PE department.
Great. Why don't you walk us through a few of the things we need to know about running a healthy family child care home?
Sure. I, for quite a few years, inspected child care facilities at the City County Health Department, and through that had experience working with providers and child care professionals on what to look for. And one of the things I need to remind people to do is to really refer to the requirements, because the requirements are very clear, and it's very helpful when you refer to the requirements. But the family child care home is a little bit different than a child care center in that the people obviously live in the home, and the home becomes their business. And it's really important because families are are in their homes, but then yet it's a professional environment as well. And germs stay in those homes. And so what we want to have really is that balance of health. And if you think of it really in maybe 3 circles, the child is a circle, and the adults as another circle, and the environment as a circle, where those 3 circles come together. That's the important thing to focus on when we think about health, because the child comes in every day from their own home environment into the home, and then of course the adults or the providers come in from either outside if they're an assistant provider, or they're actually there in their home with their family, and then the environment of the home changes. And so it's important to really think about how can we prevent the spread of disease in that way. And it's important to have good general health of the family, and the licensing requirements refer to that as far as the family members themselves, how they're supposed to be in good health and free of disease.
Let's talk a little about when a family first enrolls a child in home care. What are some of the things we need to know?
I think that there are some important things to remember as a child care provider, and that one of those is to talk with a parent about what's normal for that child, and also how that child acts when they're ill. The other thing that's important to focus on would be their immunization record. It's important to write down the immunizations that they have, and also the immunizations that they might need. And in a child care home, we want to think about when a new child comes in, you're also bringing in a new batch of germs that you introduce to the other children that are in care. So it's very important to evaluate that child to make sure that they're healthy, and how the parent, the things that the parent wants to be notified about. It's especially important for infants that the parent be notified of different things that happen during the day with infants, and especially if they become ill.
What about situations when a parent shows up with a child who's sick?
I think one of the best things that a child care home provider can have is a policy on how they want to handle children who are ill, because obviously that is going to happen sometimes, and if the parent knows up front and the child care home provider is aware and they have it written down, then it becomes more clear. But it really depends on the degree of illness. Some children maybe are just not feeling that well, but maybe they're not contagious. You have to think about the children who are present, and if you can actually have the facilities to separate that ill child away from the group. Most of the time, children who are ill do need more care, and the child care provider has to be aware of that, because she may not be able to provide the attention that a sick child needs. But it is very important to keep that child separate from the rest of the group. What we know about germs is that you're exposed to germs once and then you may not get ill. But then if you have repeated exposures, you are more likely to get ill. And some children are just more likely to get sick. Maybe their immune system is not as strong. Maybe they're just getting over an illness. But it's important to have policies and refer to the requirements on the administration of medication. There are obviously some times when it would be very important for a child who is ill not to be in care, and the parent and the caregiver can evaluate that. Because if the child is contagious with a disease, then maybe the physician has actually said they should not be in care for 24 or 48 hours. Then the caregiver needs to know about that. And it's important also, I think, to have a sheet or some way that you can inform the parents of what's happened during the day, especially if the child has been sick. The parents need to know if they're napping more, not eating as well, didn't take their medication. All these things are very important in the care of ill children. And I think, again, the requirements refer you to or have some specific things about that.
Thank you, Diane. Is there one thing that stands alone as the most important safety issue in a child care home?
Well, I think that is washing your hands. I just cannot say enough how important hand washing can be. Because what we know about hand washing is that if it does prevent the spread of germs, but it also prevents a lot of diarrhea type illnesses, just hand washing alone. And as a matter of fact, there's an actual way that we suggest that you wash your hands, and it would be a fun way to show you that if you've not ever experienced the real true way to wash your hands. So what do you say?
Let's go do it.
It's important for children and caregivers to wash their hands. There are certain times that you really want to focus on hand washing, and for a caregiver, that's before food preparation and also before feeding children, and then after diapering and after toileting or going to the bathroom themselves, and after cleaning up any kind of bodily fluids or things like wiping noses. It's a very important time to wash your hands, and then after feeding or handling pets. And with children, what we focus on them washing their hands before they eat and then also after they go to the bathroom. When you come to this hand wash area, you want to make sure that you have soap and paper towels here, and it's important to have warm water simply because you're just a little bit more inclined to wash your hands. Work up a nice lather. The soap is what combines with the dirt to get that off your hands. You want to wash your wrists, your hands. A good way to remember how long to wash your hands is to sing happy birthday 2 times. Work up a nice lather, hold it under the water, get all the soap off, wash your wrists, push up your watch, move around your rings. And it's important as you reach for the paper towel to dry your hands with the paper towel and then turn off the faucet with that paper towel. And another very important thing to remember is that the kitchen is really not the place where you want to wash your hands after you've changed a diaper. When you're selecting an area where you're going to change diapers, it's important to focus on several things. And you want to select an area that is away from your food prep. You want your supplies available and close to water. And then it's always important to refer to the requirements for the specific things.
Diane, thank you. You've given us a lot of information today. Is there a closing thought you could leave us with?
Actually, there are a couple of things. I think it's important for child care providers to think of this as an equation, to make the decision to make healthy choices for good hygiene, and then also to put those things into action, practicing good health behaviors. And the very most important thing that a child care provider can practice is washing hands. And if I had to say one thing that they could remember, and also for the children, would be to wash your hands, wash your hands, wash your hands.
Now let's look at your responsibility in transporting children. You may drive children to and from school on special trips, or maybe you'd only put a child in the car for emergency reasons. In any case, you need to know how to safely transport children in vehicles. We're here at the Midwest City Fire Department with Captain Jerry Loika, Public Education Officer. Captain Loika, thanks for joining us today.
My pleasure.
Before we get too far into this, just how important is it to keep a child strapped in all the time? Say I just want to go around the corner, get something at the store. Is it critical that I strap my child in every time?
It's really essential. Most people feel that because we're just going around the corner that nothing happens, but statistically we know that most serious accidents that occur where children are injured occur in a residential situation, not on the freeway.
What are the common mistakes that people make with regard to child seat safety?
Some of the most common things that we see are that most parents don't take the time to read their manual. And this would go for caregivers also. They need to understand what kind of seatbelt system they have in their car and then follow those recommendations. The next thing is that they don't attach the car seat properly to the vehicle. It's too loose and they don't understand how to tighten it. And then the third thing is they don't properly attach the child to the car seat. So with all 3 of those factors playing into it, it's like the child is not restrained at all.
Captain, it seems like there are dozens of types of car seats available. Can you help us understand just what types are actually available to the consumer?
Yes, it can be confusing, and we have 4 different types of car seats that are here. We begin first with the infant only, and those are designed to carry infants in the rear-facing position only. Then we move to the combination type seat that can be used for either a rear-facing infant until they reach their designated weight and age, and then they can be turned forward-facing. The next one is for toddlers only, that will never be used in a rear-facing position. And then we have a booster seat so that once they've outgrown the toddler seat, that they can move to a booster seat prior to the time that they go into a seat belt system.
All right, Captain Loika, if you could please show us how to secure the child seat in a minivan, for example.
Be happy to. In this particular car seat, we're fortunate that we have 2 belt paths so that we don't actually have to use the base.
What's a base?
Well, some of these car seats that are carriers also will have a base attached to them, or they must be attached to the base when we place them in the car. In this particular instance, we don't have to have one because it has an additional belt path on the car seat itself.
All right.
One of the most important things we need to remember when we attach the car seat is to put the carrying handle in its down position. That's the way they're designed. And with the baby out of the car seat, we will attach it to the vehicle, being careful to make sure that the belt goes through the belt path. And because there is a void between the car seat and the car itself, the seat itself, it will give it an opportunity for this to slide down. So we have to put something in there to stop it from doing that. It can be a rolled up towel, or it can be a flotation device that we refer to as a noodle. And then we put our weight in the car seat, pulling the belt as tightly as we can so that this is very snug. And if you can't move the car seat more than 1 inch side to side, then you'll know that the car seat is securely attached.
All right, now that we've secured the car seat, let's bring baby Shuli in for a ride, all right?
Okay. This is a hot summer day, and baby Shuli is very tired, and we might get her in the car seat without waking her up. But we need to understand that sometimes we'll wake them up and they do get upset. Okay, it's very important that we carefully put the harness over her head and that we attach it properly, and that we move the harness clip up to her armpit level so that it's securely attached and it will hold her in. And there should not be more than 1 finger width that we can put between her shoulder and the harness itself. Now where she's safe and ready to go for a ride.
Joan, thanks for letting us use Shuli for our demonstration today. Captain, now let's take a look at passenger automobiles. Are there any difference in securing a car seat in a passenger car as opposed to a van?
Well, the principles are the same, but sometimes it's more difficult in a car than it is in a van because of the confined space of a back seat. One final note about vans. The middle bench in the center position is the safest place to install a car seat, just like is the rear seat in the center position of a passenger vehicle. And that's where we're going to install this car seat. This is a forward-facing car seat. We want you to understand that there will be circumstances where the bench seat, the rear seat, is not going to be conducive to installing it in the center position, and you will have to put it in an outboard position. But we're fortunate this time to be able to put it in the center position. Once we have put the belt through the proper belt path, the only way that we can really get this belt tight is to put your weight in the vehicle. Now you can see here it's not very loose, but once we put our weight in it, then it becomes very loose. So as we pull all of the slack out of the car safety seat belt, and then we take our weight out of it, it's very tight, and we have no side-to-side movement. And it's critical that the car seat doesn't move any more than 1 inch side to side, and we shouldn't have very much movement forward to rear.
All right, Captain, you've shown us how to put car seats in both forward and rear facing. What's the difference?
Well, the really critical part about making the decision as to when we change from rear face to forward facing is that the child who is an infant needs to stay rear facing until they are 1 year and 20 pounds. One of the important factors to remember is that these different slots are placed in here so that when the child is rear facing, that these harness straps are at or below the child's shoulders. Once we've turned them around so that they're forward facing, then we want to move these straps to the top part so that it's at or above the infant's shoulders. And remember, it's 1 year and 20 pounds. One of the very important things that we haven't really talked about much is this locking clip. The only way that you can really be sure to understand when to use a locking clip and when not to use one is to read your owner's manual for your vehicle so that you'll know what kind of restraint system you have in your car. And always read the instruction manual that always comes with the car seat. That's the only sure way to know.
Got to read them both in conjunction.
You have to read them both.
You know, one thing I've noticed, Captain, in this day and age of sports utility vehicles and station wagons and vans, there's a lot of wasted cargo space in the back. I mean, can't we just put the kids in back some way?
We really can't ever transport children without having them securely installed in a seat belt or a car seat. Those cargo areas are not designed to hold children safely. Studies have indicated that when a vehicle is either hit from the side or the rear, that those children are ejected from the vehicle or become a projectile within the vehicle, and when they strike the interior of the vehicle, it's just like not being in the car at all. It's very dangerous for them.
Captain, you've covered a lot of information for us today, and we appreciate that. Can you help us by identifying the key elements that we need to remember about child seat safety?
Some car seats will never work in some cars, so a compatibility issue is very important.
After our first visit to the fire department, we had some specific questions about booster seats. So we went back to the Midwest City Fire Department and asked Captain Loika to explain the proper use of a booster seat.
We've spent a fair amount of time talking about car seats in general, but those are for the younger children. What we'd like to do is focus at the moment on booster seats for the older children so that we can show you some important features about installation. The most important thing we need to remember is that our purpose in putting them in a booster seat is to raise them up off of the vehicle seat, so that the belt does not ride on their belly, but it's low over the hips. And all booster seats are designed to hold this down so that it will stay over their hips. And then the shoulder portion of the belt goes across their chest and across their collarbone, and so it's not down over here over their arm or up here on their neck or face. So a proper fit with a booster seat is as important as properly installing a regular car seat.
Are there other resources that people can consult to answer further questions they may have?
Absolutely. The Safe Kids coalitions throughout the state have this information. The Midwest City Fire Department would be more than happy to assist people, and if we can't help them directly, we can point them in the right direction.
And folks statewide could give you a call, is that right?
You bet.
Okay. Those numbers are posted for our viewers right now, too. Thank you so much. Really appreciate your time, and everybody here at the Midwest City Fire Department. Thanks so much.
Thank you. And remember to take the time.
I want to remind you again to look in the requirement book for the specific requirements regarding these training topics. Our next presenters cover serious information that reminds us how critical you are as a caregiver. If you spend any amount of time as a child care professional, there's a pretty good chance that you'll run into a situation where you suspect child abuse or neglect. When you have a concern that a child is being abused or neglected, you have a legal obligation to report the suspicion. All you have to do is report the suspicion to the Child Welfare Division. OKDHS will determine whether abuse or neglect has occurred. Norma Eves from the Child Welfare Division visited our studio a while ago, and through the use of some volunteer children and a professional makeup artist, she showed us some examples of what child abuse might look like.
Today we have a makeup artist assisting us by illustrating injuries on children. The location of these injuries can help identify possible accidental and abuse-related injuries. First of all, let's discuss the locations of typical accidental injuries on children. These areas include forehead, shins, forearms, and thighs. Now let's take a look at a child. Forehead, forearms, and shins. When you think about accidental injuries, you must take into consideration the age and mobility of the child. The areas of typical abuse-related injuries include eyes, cheeks, ears, areas just above the knees, genitals, middle of the back, buttocks, upper thighs, calves, and abdomen. Again, let's look at a child. Cheeks, thighs, abdomen, and stomach area. It is more difficult to bruise an area of the body where there are large masses of soft tissue. Bruises in these areas are more likely to be abuse-related. In addition to the location of the injury, the shape of the injury can be a clue to what was used to inflict the injury, thus identifying abuse-related injuries. For example, if a child has been struck with force with an extension cord, belt, board, hand, or fingers, a distinct mark or impression will be left. Here are examples of real child abuse situations. Remember, the age and development of the child is very important in assessing whether the injury is accidental or abuse-related. For example, if a 3-month-old child comes into your care with bruises on his face and mouth, it is highly unlikely these are accidental injuries. Let's talk about behaviors and characteristics of children which might indicate abuse or neglect. Extremely fearful behavior. For example, if a child ducks when you move your hands around them, they may be fearful of being harmed. Extremely aggressive, demanding, or rageful behavior. Some abused children display these behaviors as they are starved for attention and desperately seeking it. They also may be imitating the behavior of their parents. Overly compliant or passive behavior. These children may allow other children to take things away from them or go along with whatever is suggested. This may be a result of trying to avoid a violent assault. Extremely dependent behavior. These children may cling to staff and have difficulty separating from them. Keep in mind the age and development of the children to determine normal dependent behavior. Role reversal behavior. Watch for children who assume the role of parent of the other children. They may also comfort and nurture the other children. Extreme lags in development. These may be the result of emotional deprivation or nutritional neglect. Indiscriminately friendly behavior. Many abused children are so hungry for affection they are inappropriately friendly with strangers and playmates. Multiple explanation of injuries. If a child offers more than one explanation of what did or didn't happen to cause the injury, this could be a clue that the injury is abuse-related. It is important to note that behavior and characteristics alone are not necessarily an indicator of abuse or neglect in a child. You must look at the whole picture. What are reporting requirements in Oklahoma? Healthcare professionals, teachers, and anyone who has reason to believe that a child has been abused is required to report the matter promptly to Child Welfare in their local Department of Human Services county office or to the statewide child abuse hotline by calling 1-800-522-3511. Yes, this does include the owners, operators, and staff of all child care centers and homes. It is important to remember you do not have to know all the facts. You do not have to have all of the answers. If you suspect child abuse or neglect, you have to report the incident to Child Welfare. Let Child Welfare do the investigation and make the decisions. Failure to report suspected child abuse or neglect in Oklahoma can result in criminal charges being filed against you. It is natural for you to be concerned about your obligation to report. It is likely you will have questions about what you have seen and heard. Do not hesitate to contact Child Welfare Services or daycare licensing for guidance. What is the definition of child abuse? In Oklahoma, it is defined as harm or threatened harm to a child's health or welfare by a person responsible for the child's health or welfare. Harm or threatened harm may occur through non-accidental physical or mental injury, sexual abuse, or neglect. A child means a person under 18 years of age. Physical abuse is non-accidental injury to a child. Physical injury means temporary or permanent damage or impairment to the body. Mental injury means an injury to the child's intellectual or psychological capacity. It is the result of a pattern of cruel acts or statements made to the child or in the child's environment. This could include a child who is exposed to domestic violence. Sexual abuse includes rape, incest, lewd or indecent acts or proposals, and sexual exploitation. Neglect is indicated when the parent or person responsible for the child fails to act in a prudent or responsible manner to provide for the health and general welfare of the child. Long-term neglect could cause serious harm to a child. Examples would include inadequate clothing, food, shelter, medical care, or supervision appropriate to the child's age or development. Please remember, Child Welfare is here to assist you with difficult situations. It is vital that you remember that as caregivers of children, you are an important link in providing for the health and safety of the children for whom you provide care.
The safety and protection of children is everyone's legal obligation. So remember, when you suspect child abuse or neglect, it's your duty to report it. Our next topic is sudden infant death syndrome, otherwise referred to as SIDS. This topic can cause anxious feelings among child care providers and parents alike. There are numerous practices that can greatly reduce the chances of a sudden infant death. Pat Dameron, the past SIDS program coordinator at the Oklahoma State Department of Health, helped us understand what SIDS is and ways to reduce the chance of sudden infant death syndrome. You're with the Oklahoma State Department of Health. What's your position there?
Yes, I'm the coordinator of the SIDS program, and our program provides support and education for any kind of SIDS issues that may occur in the state of Oklahoma.
Well, what is SIDS?
Well, SIDS stands for Sudden Infant Death Syndrome. The definition of SIDS is the unexplained and sudden death of an infant under the age of 1 year.
Well, what do we know about the victims of SIDS?
Well, there are some things that we do know. We know that generally infants die between the ages of 2 and 4 months. That's when we see the peak of deaths. And then after 6 months it begins to go down and decline. But we can still have a definition of SIDS deaths up to 1 year. The other thing that we know is that these are generally healthy babies. that these are full-term babies. So sometimes people think that these are sickly babies, but they're not generally. The other thing that we know is that these babies, generally we see a higher rate of boys dying of SIDS than girls. We also see a higher rate of SIDS in the winter months. Now, we can't predict SIDS and we can't prevent SIDS. We don't know what causes SIDS, so we don't have the ability to do that. The other thing is that we will generally see that the baby dies within seconds. So sometimes parents will say, I didn't hear them cry out, did they suffer? But they die within seconds. There doesn't seem to be a struggle in that respect. The other thing is that sometimes people will think that these babies have suffocated, and this is not a suffocation. This is a different kind of death.
Does the research help us in any way to help lower or minimize the risk of sudden infant death syndrome?
Well, as I mentioned, we really don't know what causes SIDS, but there are some tips that we can have present within a home or within a daycare setting that would lower the risk of a child dying of SIDS. I'd like to take you to a sleeping area where I could show you some of those things. This is a good example of the sleep environment that we're looking for. First of all, it has a firm mattress. And the other thing that we're looking at is that the mattress does not have any space between the rails and the mattress itself, so that there's no space that the baby's face can get down in there and get suffocated. The other thing that we don't want to see, and what we would call a bad surface, would be a waterbed, a beanbag chair, anything where a baby can get their face into a pocket and not be able to breathe properly. The other thing is that we don't want any stuffed animals in here with the baby while the baby's trying to sleep, like she doesn't have any now. Again, so that the baby can't get their face up there with something that they couldn't breathe properly. The other thing is that we don't want the room too hot. A lot of times with babies we think we need the room hotter than it needs to be. If you're comfortable, the baby's comfortable. Then we want a smoke-free environment. We don't want an environment where anyone's smoking or there's passive smoking going on. This makes a higher risk for SIDS. The last thing, and the reason that we're seeing, and we feel that we're seeing a decline in SIDS, is because of back to sleep. And that is an initiative that we're seeing all worldwide on putting babies on their back to sleep. Now, this will not prevent SIDS 100%, but what we're seeing is a very drastic reduction in SIDS by putting babies on their backs.
We asked Pat to describe what to do if an occurrence of SIDS takes place in a child care home. She said the first thing to do is call 911. Pat then went on to explain what would happen next.
First, the EMT would arrive, the emergency medical technicians. Then the police would arrive. And sometimes this is very hard on people because they will come in and start a criminal investigation because they don't know what they are walking into. Then at that point we also will have the ME or the medical examiner come, and they will be the one that will examine the child and pronounce the death. One of the things also that we need to remind people is an autopsy will be done. This is the only way that we can verify if this is SIDS or not, or if the child died of something else.
Before we finished our discussion about SIDS with Pat, I asked her about the guilt that a child care provider might feel after experiencing such a tragedy. She had some helpful advice.
Well, I think it's important for a provider to remember that as long as they've given the best care possible to that child, that they really have no reason to feel guilty. Nothing is probably going to take away the inevitable sorrow that a provider is going to feel in losing a child. But one of the things that they have to try to remember, or hopefully will remember, is that no one knows what causes SIDS, no one can predict SIDS, and there's no way to stop SIDS. The other thing is that we do have support available.
Pat Dameron, thanks so much for visiting with us today. We really appreciate it.
Thank you for having me.
And those numbers that Pat mentioned are on your screen right now. Another all too familiar tragedy is a situation you need to be made aware of. Shaken baby syndrome can result in severe injury or death. Dr. John Stemke, the head of pediatric emergency at Children's Hospital in Oklahoma City, spent some time with us to explain how to identify shaken baby syndrome and what to do. He also continued our discussion about child abuse. This is Dr. John Stemke. He leads a team of health professionals at the emergency room at Children's Hospital here in Oklahoma City. Doctor, thanks so much for taking time to talk to us today about child abuse.
You bet, David. Good to be here.
Now, our audience is made up primarily of child care providers, so I'd like to start the discussion by talking about the procedures that someone needs to follow if child abuse is suspected.
Sure. And it is important for daycare workers, child health providers, child care providers to know their law and the procedures to follow in their locale and their state. Every state is slightly different, but there are common denominators of dealing with this. If a daycare worker truly suspects abuse and neglect, then they're obligated by law to report it to their appropriate authorities. That may be a child abuse hotline. That may be their local child welfare offices. But certainly every daycare, child care provider should have a number, know the number to call, so indeed they can make that report of suspicion.
Doctor, doesn't the law require providers to report child abuse?
Oh yes, it does. But I want to stress that it's what you're reporting is a suspicion of child abuse. And I think a lot of people become confused with that term, and I think that can be intimidating to a lot of folks because they say, gee, I'm not sure I know what it is, or do I have to prove it, and do I have to investigate it? And I think the important thing is just to recognize that the way the statute is written, and in most states, and certainly in Oklahoma, it's the suspicion of abuse and neglect. And if you, in your job, profession, as a child care provider, if you have a reasonable suspicion of abuse or neglect, then the law requires you to report that suspicion. And it's also important to recognize that the law doesn't require you to have to show it. The law, you have satisfied the legal requirements if you've just reported that suspicion. Then that suspicion is reported to child welfare. Child welfare is expected to investigate, and the results of that investigation is made available to the district attorney's office. Now, in many states and many arenas, if this suspicion comes out of a daycare center, then usually that state's agency relating to licensing of daycare or child care providers is involved in the investigation. But I think that should make it an easy process for any person to do. Is you pick up the phone and say, gee, I'm concerned.
So it's really the reporting of the suspicion that's the important thing.
Oh, absolutely. And all you're going to be asked is, gee, why are you concerned? And it's perfectly all right to be concerned. In fact, we want that. And the law recognizes also that sometimes you'll have concerns that it really is an abuse. And that's also okay, because you'll never get into trouble for reporting a suspicion of abuse, even if you're wrong. And that was recognized up front when the reporting legislation was passed. Yes, there's going to be erroneous reports.
Right.
And that's perfectly okay. And because the whole purpose is to protect the child and to provide services to families. And so the child care provider has no responsibility in investigating. It's just a matter of reporting a suspicion, and the law protects you from any retribution by virtue of making that report, even if you're wrong.
Most injuries caused by child abuse are pretty easy to spot: bruises, burns, broken bones, and so forth. But I'd like to talk for just a minute about something that may not show outward symptoms, and that's shaken baby syndrome. Now, could you please tell us a little bit about what shaken baby syndrome is and how those injuries are caused?
Oh, you bet. Unfortunately, it's more common than many people think, and it's a major cause of death and morbidity in children, particularly under 2.5 years of age. We see approximately 1 to 2 such children a month in this very emergency department. And not infrequently, these children may be brought in from child care facilities. And the cause is almost universal. a principal caretaker losing control with the child. They've had it. They become very frustrated. Usually the child's crying, gets on their nerves. They may be under stress from other things, and then they just lose it with the child. And they grab the child, usually by the chest or around the arms, and violently shake the child. And I have to stress that it's a very violent shaking. We're not talking about playful shaking with a baby, which, while we may not advise it, we have no evidence that that causes harm. This is a very violent act, and the extent of the violence is such that even were a layperson happened to walk by and observe this while it was in progress, they would, not knowing anything about it, would immediately recognize that this was a very violent act, that this child was being truly assaulted. And so they lose control, and it's usually because of the baby's crying that just gets on the nerves, and they've had it. Sometimes they're not even aware of how much they've lost control with their baby at that point in time. During early development, a baby's head is relatively heavy and the neck muscles are weak. The brain and the connecting tissue are very fragile. That's soft. And I've often used the analogy of a developing baby's brain being like Jell-O. And when the Jell-O is shaken, little slits and tears can occur in the Jell-O. This makes the brain very likely to be severely injured if the baby is shaken. When a baby's head is shaken, the force of the brain moving back and forth, or a sudden impact from being thrown or dropped, may cause the delicate blood vessels between the skull and the brain to tear. This bleeding may occur inside and outside the sections of the brain. This, of course, can result in severe brain damage or even death. If death is avoided, the brain damage may prevent the baby from seeing or walking or talking for the rest of their life. Even the slightest injury can cause permanent brain damage and physical impairment that may not become apparent till later on in life. It only takes one time or just a few seconds to hurt a baby for the rest of its life.
It sounds like these injuries are happening too frequently. Who's responsible?
Well, the principal caretaker, or what we call the primary caretaker, usually mom or dad, or is not uncommon, mom and boyfriend, one of those two tends to be the primary perpetrator most of the time. Certainly it can happen in other places. Anyone that takes care of a child, particularly if they're under stress and have a short fuse and a short temper, can lose it, so to speak. But the most common is either the parents or a common factor is the mom's boyfriend, not infrequently.
So what are some of the signs or symptoms that a child care provider might look for?
Well, it's an excellent question because sometimes it can be very hard to recognize, or it may not be recognizable at all. But usually it may present with the child being incredibly irritable or fretful, and the child really being almost unable to be consoled. On the other hand, and the child may be eating poorly, and the child care provider can simply note a drastic change in the way the baby acts. If the child care provider really knows their baby, then when the child comes in and is a marked change of behavior, obviously they can be concerned about it. The findings that may present even more dramatically. The child may have an episode of not breathing. We call it apnea episodes. The child may turn blue, which we call cyanosis. The child may have a seizure. And this type of activity or symptomatology or symptoms might result in the child care provider calling an ambulance or calling help in that sense. So the symptoms can be very subtle. Sometimes the child just appears ill, throwing up, vomiting. A lot of times the child may have a bulging soft spot, a bulging fontanelle. if the baby is less than 9 or 10 months of age and the fontanelle hasn't closed. So that there can be really a wide variation of symptoms, and some of the symptoms may be just simply those symptoms of what you would otherwise suspect to be a sick child, in which case then the child care provider's concern about that would be expressed to the parents or that sort of thing.
Doctor, you've covered a wide range of symptoms here, but they don't all mean that shaken baby syndrome has occurred, do they?
Oh gosh, no, and obviously that can be difficult. The main thing is that the child care provider knows their child, knows their baby, and because other illnesses can have the same symptoms. It is important to know that, and also to know who you will call if the child's ill. If the child suddenly has a seizure or quits breathing or turns blue, then we hope the child care provider will know what to do in those set of circumstances, rendering immediate first aid and calling 911. On the other hand, if the child is ill, is vomiting, is sick, is terribly fretful or fussy, then the child care provider needs to get hold of the parents so that child can have medical care. And indeed, it may be an illness certainly other than shaken babies, because babies, all these symptoms are caused more commonly by things other than shaken baby, thank goodness.
Doctor, child care providers do very rewarding work, but it can also be frustrating sometimes. What do you say to a child care provider that becomes so frustrated they want to act out their frustration with the baby?
Well, certainly that can happen, and babies can cry, and babies can be irritable, and they poop, and they throw up, and they do things sometimes more often than it can get to anybody. And the most important thing is to kind of, if you can recognize it yourself that, gee, that baby's really irritating me, take a break, walk out of the room. Even if the baby's still crying, crying won't hurt the baby. Take a deep breath, count to 10, whatever you like to do, you can leave the situation. Then you could come back and perhaps just walk with the baby, walk outside, do something different, just kind of refocus. I think the most important thing is to recognize that the baby's getting to you, and give yourself a break in that situation. If you can, or in an environment where another relative or caretaker or someone else in the home can watch after the baby, why, that's also a reasonable thing to do. But babies can get on people's nerves, and that can happen with anyone. The most important thing is simply to recognize it. But whatever you do, don't shake the baby.
Are there any other resources available for a child care provider that wants to learn more about this?
Oh yes, there are. Certainly you can contact your local child welfare agencies. Additionally, your local child care licensing agencies will have information about this. Many states have available emergency medical services for children programs available, or resource center, which also has information that can be shared.
Dr. Stemke, thank you so much for visiting with us about this important topic, and the staff here at Children's Hospital ER. Thanks so much.
Thank you, David.
Now we turn our attention to fire safety and prevention. By preparing in advance, you can make your family child care home or large child care home safer and ready in case fire breaks out. Major Otis Greenhoward from the Oklahoma City Fire Department spent some time with us to show us how to be prepared for fire. This is Major Greenhoward from the Oklahoma City Fire Department. Major, thanks for joining us. Can you tell us about your role in educating people about fire prevention and fire safety?
Well, David, I've been on the Oklahoma City Fire Department for over 20 years, and currently I'm assigned to the Prevention Office and the Public Education section, where we deal with the public. We go out and educate the public on fire safety issues, and currently I coordinate a program which is called the OKC Fire Smart Kids Club, which deals with child care homes as well as daycare centers, whether it's small or large. And they cater to the pre-K age children. So that's our message to those homes, to make them safe.
Right. We do have some requirements that are available in your requirement books, so you're going to want to be aware of those requirements and be in compliance with them. Can you tell us about some of the considerations of the home and its physical condition that we need to be aware of?
Oh, sure. Proper maintenance of a home, making sure that it's safely wired, as well as not utilizing extension cords as permanent wiring. Also, making sure that the outlets are covered so the children aren't sticking things in there that may be electrocuted, things of that nature. Making sure the house is maintained and clean and free of debris.
Not all family child care is operated in a house. Are there different considerations for an apartment or a mobile home?
Yes, that's correct, David, and that's why it's very important that you refer to the requirements for the multifamily homes.
Major, we've talked about the main structure. Are there any special considerations for heat sources?
Yes, no unvented heaters, heating equipment free from debris, free from combustions, and what people normally do is like to store things in those closet areas where those heating equipment is located, as well as guards around hot surfaces and open flames, such as a floor furnace, as well as a wall furnace, as well as fireplaces. They should have a solid door, a glass door in front of it, to keep kids from getting into the fire, whether it's throwing objects into the fire as well as any objects coming outside the fire.
Major, we've talked about fire prevention measures. What about a worst case scenario? You've got a fire, how do we get out?
And that is very important, making sure that you have a way out. Each room should have 2 exits. One should lead a pathway outside. None of the exits should be obstructed, so make sure all of the exits are unobstructed.
We all know that everyone needs to have working smoke detectors, but are there any special requirements for child care homes?
Yes, a smoke detector should be located on each level of the home, located at the top of the stairs, as well as where the children sleep or where the children play. Make sure that the detector is maintained. If you hear it beeping periodically, that means that the battery is low. The fire department recommends that you test the smoke detector at least once a month and change the battery at least once a year.
We've heard of carbon monoxide detectors. Now, what are these and how do they work?
Carbon monoxide detectors are great to have because carbon monoxide actually is the leading cause of poisoning in America. Carbon monoxide is a tasteless, odorless type of gas which is produced by combustion as well as any type of fossil fuel that burns. Make sure you check your requirement books to see when they're necessary.
Major, it's required that we have fire drills to make sure that children are able to get out safely. Can you tell us just how important it is to conduct these drills?
They're very, very important. It's the difference between life and death. The fire drill should be done so that the child, as well as the adults that are overseeing the children, know the exits to get out of that building in case of a fire. It's very important that they practice it and at least do it quarterly so that they're familiar with the exits and how it is executed.
Now, all child care homes are required to have a fire extinguisher on hand. Can you tell us exactly why that's so important?
It's very important in case a fire occurs. And since kitchens are normally a place where fires may occur, let's go talk about fire extinguishers in the kitchen.
Major, I can see why a kitchen might be a source for a lot of fires.
Of course, yes, there's a lot of cooking done in this area, so you always want to make sure that you have your fire extinguisher located in the kitchen. Make sure that it's accessible to the adults that are cooking. And whatever you do, don't place your fire extinguisher near or on the stove, okay? And the type of fire extinguisher that we recommend should be an ABC or a BC. And all that stands for is there's the 3 classes of fire extinguishers, and A class is for ordinary combustibles, such as paper, wood, or clothing, and B class fire extinguishers are for grease or any type of liquid fire. Class C type fires are your electrical energized type fires. So if one of these stovetops caught on fire, or if something on the stove caught on fire, you could easily use this. If this is not available, if it's not available and say you have a grease fire, you can always utilize baking soda, salt, the lid, things like that, but we don't want you to use water or flour. When you use those things, that's when fire spreads and creates a bigger situation.
Well, fortunately, most people have never used a fire extinguisher. Is there a preferred method for using it?
Yes, there is. Let's go outside and I'll demonstrate to you how it's used. All right, David, this is how we do our fire extinguisher demonstration. Let me take time out to light the fire. Well, as you can tell, it's not a very big fire, and it's a liquid fire. Would you hold this, please? Anytime you use a fire extinguisher, David, you should always do two things. Contact the fire department and evacuate the immediate area. Now, we also use the technique pass when we demonstrate how to use a fire extinguisher. That's basically teaching them how to pull the pin, aim the nozzle, and squeeze the trigger and sweep at the base of the fire.
All right.
We're ready to put it out now. Always approach the fire at 8 to 10 feet, pulling the pin, aiming the nozzle, and squeezing the trigger.
Thank you, Major. Appreciate it.
It's been my pleasure.
Our final topic today may be the most complicated topic we discuss. While a fire or other life-threatening situation is important to prepare for, behavior and guidance is an issue that comes up all day long, every single day. Pam Ramming is an 18-year veteran in statewide training for child care providers. She also owned and operated a family child care home for 6 years. Pam has dedicated much of her career to understanding and teaching techniques for positively guiding children through the day. She sat down with Mitzi Lee, a policy and training specialist for Oklahoma Child Care Services at OKDHS, to discuss behavior and guidance.
Pam, thank you for talking to us today about this important topic, behavior and guidance. You have a bachelor's and a master's in early childhood. You also worked in child care, correct? Child care center, and then actually Pam had her own family child care home for several years. Most recently, Pam has been a trainer and consultant all over the state, having trainings and helping providers with a whole lot of other issues, not just behavior and guidance. When we think about behavior and guidance, you know, your requirements list some things, some do's and some don'ts, and some guidelines for you. But Pam, it really is a broader issue, more about the philosophy of really opening your home to children.
You know, Mitzi, that's the hardest thing I think most providers really deal with, is it's changing your home into your business. And understanding that you're not parenting other people's children,
Right.
You're providing care for them. And so it opens up a whole myriad of conflicts and issues and situations that you really have to have some forethought to and be prepared to deal with as you enter into your new business.
And I guess it would be common that as a new family child care home, you might not think of that initially.
You know, most people come into child care because they didn't want to leave their own children
That's right.
with other people. And so they are providing very, very good care for their own children. And we're switching topics and we're moving when we start taking care of other people's children.
So Pam, in starting out of us really looking at this journey of behavior and guidance, maybe one of the first things is to think about understanding developmental stages of children, child development, appropriate expectations.
That's right, Mitzi. When we look at the research and we know what happens in child care, some of the things that are very important to focus on and to understand is that children are going to come into your home,
And it's not really an appropriate place to have your grandmother's favorite vase laying down. Those are the kinds of things that you want to put up and protect, because your home becomes their environment. It is a place for the children to be. So when we look at what happens in our home, we have to stage everything appropriate for children, and we have to really put the children's needs ahead of our own family setup and what's comfortable for our family. We have to put up all of the breakable things. We have to include all those safety plugs and all of the things that licensing reminds us to make sure our environment's safe. But as we look at behavior and guidance, we also have to change our expectations of the rules of our household. One of the fastest ways that we know to improve behavior and guidance is to improve outside play by 30 minutes first thing in the morning.
That's fascinating. So outdoor play really does help with behavior and guidance.
When we look at outside play, just the simple fact of putting children outside under supervision, actively playing for half an hour first thing in the morning will improve your behavior and guidance by up to 30 to 50%.
Who would have thought, Pam, that outdoor play actually helps with behavior and guidance? That's an awesome tip.
You know, when we see that the outside play has made so much difference, it helps the children with their energy level, and it gives them something constructive to do. It's really hard to convince everybody that we need to be outside that much, though.
And I know sometimes the issue gets to be, it's too hot, it's too cold, and certainly children being dressed appropriately, having enough water, all those issues, but you really do need to have them outside, and the payoff is big for you as well.
Yes, and it also goes to show how important your outside environment is as your inside environment is in your safety proofing, planning for children to be outside.
Now, we aren't talking about you needing to be an expert in child development, but you do need to have that knowledge. Additional training's helpful, as well as it helps with these expectations.
You're absolutely right, Mitzi. When you look across our state, there's lots of training programs that are available. Your licensing worker can give you a list of trainings that are available in your area. There's lots of statewide trainings. There's lots of resources that are available to get that extra level of behavior and guidance training that anybody who works with children needs, especially somebody who works with very young children.
So really, one of the first basic things, be sure you have some knowledge of child development and appropriate expectations with children.
Yes, it's very important.
Pam, another point about behavior and guidance that some people may not really relate to it is parents are certainly partners in child care, but good parent communication can also help with behavior and guidance.
A wise child care provider once told me that what happens at my house is between your child and me, and anything that is important that affects your family, I will share with you privately, obviously not in front of your child, because those bigger discipline and guidance issues should be the things that are happening between parents and child care providers. Perhaps if we're working on the same topic, we're working on not hitting or not using potty words, some of those kinds of things that everybody needs to be on the same page about, and we need to be working together. However, all the little, he hit 17 times today, we need to monitor that and really cut those pieces of information back and provide those in a caring way.
So you handle it, it's in your environment, you're in charge of that, and it pretty much just rests there.
Yes.
And so you mentioned about consistency. Then I would think that it could be very helpful to explore with parents how they may discipline at home, but that can kind of be sticky a little bit too.
Very sticky.
Okay.
It's very important that you do know what's happening at home and that you're sharing information both that the family tells you how they're handling problems and you're sharing how you're going to handle problems. Families a lot of times have discipline techniques that we cannot endorse in childcare. And when you look in your licensing book and you see policies, you'll see lots of things that are just not appropriate to do with other people's children. And so when you think about those things and you have those communications with parents, part of your job as a child care provider becomes to educate them on the options and the ways of handling situations that are age appropriate for their child.
So when you find out how a parent may be handling something, always go back to the requirements, be sure it is meeting that guideline, and then adjust as need be with input, because it really is about a parent being a partner with you.
Yes. And don't be afraid to use your resources. Go back to your licensing worker and seek out, again, back to receiving more education.
Pam, behavior and guidance really is not just about some things you shouldn't do, but you can do some things to help stage it to prevent some things from happening.
You're right, Mitzi. I like to talk about the difference between prevention and intervention. You know, it's the whole, you can exercise and keep from having a heart attack, or you can do CPR. And part of behavior and guidance is having a good exercise program. And our exercise program would be how you set up your environment, having a solid schedule, lots of planning and pre-organization of your materials, pre-organization of the meals that you're preparing. All of that pre-organization sets the stage for a good day with children. You're less agitated because you haven't got the meat cooked that you need for lunch when somebody needs you to help them with their painting project.
So planning really can help. Also, being sure your assistant caregiver is on board and on the same page as you, as well as any substitute that might be with the children should you have to be away.
And following your consistent behavior and guidance plan. Having them using the same words that you're using. It's very different to say, don't run in the house and use your walking feet. It's two different languages for children, and we have to really embrace that and make sure everybody's using a consistent language and a consistent consequence for any behavior that you would have that needed an intervention instead of a prevention.
So telling children what to do instead of, no, don't do this.
Absolutely.
Pam, let's focus a little bit on some of the high points that we know from licensing can kind of come up occasionally, not all of the time. But punishment not being associated with food, rest, or toileting. That is kind of a biggie.
And 3 hot places. Nobody likes when children have accidents. Accidents are messy. And the most proactive thing you can do is just re-engage those children to take care of themselves, to clean up their messes, which are age appropriate in the expectations that you have. And then around food, you know, there's lots of things that children have never experienced before, and so they're not going to try and they're not going to eat. We have to offer those things and not enforce that children eat everything. They need to have some on their plate.
Sample some things.
And look at it. You know, it can be on your plate, but you don't actually have to eat everything that's given to you. And not eating your broccoli shouldn't keep you from having your dessert either.
That's right. Or the flip side of that, you have done this today and that was an issue, so you don't get snack, or you don't get dessert, or you've done this and I'm going to send you to bed. Things that are just not appropriate.
The other thing, Mitzi, is nap time is always an issue in childcare, because around 3 and 4, children stop wanting to cooperate at that time. And so that's another huge place that we see childcare issues, is putting kids on their cots when it's not actually nap time, or forcing kids to stay on their cot way past the right amount of time. And so establishing good routines and having a good plan of you can read a book, you can listen to some soft music. There's lots of things you can do to be quiet while other children rest. But not engaging in that power struggle with children becomes a hard topic for providers,
I bet.
but an important topic for kids.
One other thing too, kind of around this eating, is that to put a child in a high chair maybe as a time out or something like that, and certainly a smaller child, that could associate punishment with food if a younger child eats in that high chair. So you really need to be careful about that too, because children can identify then, I got in trouble and now I'm in the high chair.
People don't really understand what discipline is. Discipline means to teach. It does not mean to punish. And so people think that by punishing children, by using timeout, by using all of these other techniques that we're talking about, and that's not really what teaching is about. Teaching is about teaching the appropriate thing that you're expecting of children. There's a famous NAEYC president who said, if a child doesn't know how to read, we teach them. If a child doesn't know how to multiply, we teach them. If a child doesn't know how to drive, we teach them. But if a child doesn't know how to behave, we punish. And so it really makes us come back and think about what discipline means and how to go about those techniques and how to teach children what it is our expectations are and what it is we're looking for in their behavior.
And really, timeout has been very popular. It may work with one child and not work with another. And it is certainly not the only method to use.
It gets so overused. You know, a child should not be spending a majority of their day in timeout.
And I'm very glad you brought that up, because your requirements are very specific about the length of time. Pam, one other thing is being very careful that chores or excessive exercise is not used as a method of behavior and guidance.
You know, actually chores are fun for children, Mitzi.
Well, it's really responsibility, not punishment.
And that's how we should be using it. We should have our chore chart and all of the jobs that we assign children every day. But our children shouldn't be doing our yard work, and they shouldn't be cleaning our house for us. They should be cleaning the table after they've eaten at it. They should be learning personal responsibility at the ages that our children are in child care. And so all those extra jobs and that excessive exercise and that excessive work doesn't have a place in our daily routine.
And it really goes back to this cleaning up after yourself, really goes back to this whole teaching philosophy.
Yes, it does. And that's what young children in child care are at that prime learning age. They're ready to learn all those exciting adult activities that we do. They think doing the dishes is actually fun. You know, threatening becomes one of those issues that goes along with consistency, that we as women have a tendency to threaten and threaten and threaten and then follow through with what we've asked children to do. And one of the key factors of consistency is to ask children, to tell children, and then to follow through with the words that have come out of your mouth.
One other thing about threatening is you will not be able to spank children, but you would not want to threaten and should not threaten to spank children, even though you might not carry that out.
Absolutely.
Pam, just a few closing thoughts. Licensing really is a partner and a very good resource to help with any training, resources, materials around this subject, as well as anything else.
If I could give you a few final thoughts to the providers out there, the one thing I would say to you is take very good care of yourself. Your health, your rest, your well-being is not only now important to you and your family, but to the children that you care for and the parents that are dependent upon you for care. The other thing I would always remind families is that outside play really does make a difference.
Pam, thank you so much. This is an important topic. It's a complicated topic, and you have been so helpful.
Thank you for having me.
You're welcome.
I want to thank all of our guests for helping us illustrate the important methods for keeping children safe and healthy. Each of them added to our knowledge, and we appreciate them. I need to remind you that you must be very familiar with the requirements in this book. Your family child care home or large family child care home must comply with the licensing requirements. Finally, I want to thank you for watching. We're extremely happy you've chosen to open your homes to children and families. The safety, security, and love you provide to them will help them as they make their way to adulthood. Keep up the good work. Goodbye.